I am Dr. Meenu consultant at Birla Fertility and IVF, Rohini, Delhi. I am going to talk about the science behind egg freezing. What is egg freezing? It is a procedure wherein a woman who wants to delay her childbearing because of certain reasons can undergo a process called ovarian stimulation, have her eggs retrieved and have them frozen. These frozen eggs can be later fertilized and can give her a pregnancy. Now, what can be the reasons that a woman may want to undergo egg freezing? These can be the very fact that she does not want to start a family yet, could be because of a professional, personal reasons, some psychological or social factors. Also, there are certain pertinent medical reasons, like if she has a condition called endometriosis, or she can be suffering from premature ovarian failure, as in Turner's. So these could be some of the medical conditions. Sometimes we come across a subset of women who may want a gender change. So they may want to preserve their fertility for a later stage in life. Also, there's an emergency condition wherein a woman is detected with a cancer. She has to undergo a chemotherapy or a radiotherapy. And then she may want to preserve her eggs for a later date. So this is a very, very pertinent kind of a science or a procedure. Very much acceptable by world bodies across. And also, you would like to know that the success rate of the procedure is as high as 90 to 97%. So post freezing and thawing, the oocyte retrieval rate is as high as 90 to 97%. And even the clinical pregnancy rate is as good as 5 to 12%. Now let us understand how does one carry this procedure. The steps are such that normally, after a woman is investigated and all her reports are normal, we will start her on a stimulation with certain hormones called gonadotropins, usually starting on day 2. And then we monitor her with serial ultrasounds and along with some hormonal tests and see how the follicles are growing. Now, once the follicles are ready, we are going to ask her to undergo a procedure called ovum pickup or oocyte retrieval, which is done under a short general anesthesia. Now, once her oocytes are retrieved, they will be frozen or cryopreserved. And then at a later date, when she wants to conceive with these frozen eggs, they will be thawed. They'll be fertilized with either her husband's sperm or a donor sperm. And subsequently, the resulting embryos can be transferred back to her uterus and she can conceive. Also, there's a process called a random start protocol. So we're not starting the hormones on day 2 in this particular protocol, but any time of the menstrual cycle. This usually is applicable in women who have a certain cancer and sudden, decision has to be taken to preserve their eggs. And this technique is definitely a very useful procedure for lots of women who want to control their fertility and preserve their fertility for a later date. So please, all women who want to undergo social egg freezing or they want to have their eggs preserved for some medical reason, reach out to your fertility consultants and seek this process.